Thank you. It's a pleasure to be here today and have the opportunity to present some results from two projects that I've been involved in that have looked at return to work issues um, and looking specifically at barriers to return to work in a context of social vulnerability. So to give a little bit of context, as John mentioned, most workers are able to return to work after work-related injury or illness, but some are having difficulties either finding employment or maintaining employment. And often they return to jobs that have worse conditions than they had before their injury. Now, vulnerable workers may experience return to work barriers and impacts also of unsuccessful return to work disproportionately or differentially. And today I'm going to be speaking about the experiences of workers who lack English language proficiency. Now, when we think about the expression vulnerable workers, so before I start, I do want to mention that it's important to keep in mind that when we talk about vulnerability, we're talking about vulnerability that doesn't come from within the worker. It's really vulnerability that comes from the way that the system is organized. And I'm hoping that through my presentation, when I outline some of the problematic policies and practices that make it difficult for linguistic minorities to return to work, that this really can be highlighted. So the vulnerability really comes from the system, not from the individual. And this perspective is important because it has implications for what we propose as solutions. So solutions are either geared at changing the individual or at changing policies and practices. Now, there are many different types of vulnerability. And so today I'm going to be talking about one type of social vulnerability. But there are also other types of vulnerability to keep in mind. So, for example, physical vulnerability or psychological vulnerability, which usually refers to the experience of chronic illnesses, for instance. So in talking about return to work issues in a context of social vulnerability, I'm going to be referring to two studies, one that I conducted, one that I helped conduct. The first one, as I mentioned, is on linguistic minorities, and it's really a study focusing on barriers. And the second one looked at a diverse group of injured workers, and that one is really focused on impacts. So for the first study, a little bit of context. Now, we know that linguistic minorities have difficulties reintegrating the workforce following a work-related injury or illness. Data from the WSIB, this is from a few years ago, showed that those who speak French and those who don't speak English or French actually have extended benefits durations. And this is even after controlling for the nature of the injury or illness. And according to WSIB statisticians, this discrepancy could be due to return to work difficulties among workers who don't speak English. This issue is important because of demographic transformations. In Canada, because of immigration, the proportion of the population that has a non-official language as mother tongue is only going up. And projections show that in the next 2 decades, it will reach 33% of the Canadian population. Another reason why this population is also important to look at is that research has shown that linguistic minorities are actually at increased risk of experiencing an occupational injury or illness in the first place. And this is because they're often employed in jobs that are manual, so jobs that don't require command of the English language, and these jobs tend to be at higher risk. So the objective of this first study was to identify the WSIB policies and practices that lead to unfavorable return to work outcomes for this population. So what we did is we examined appeals decisions. And the reason why we focused on appeal decisions is because those are the only ones that are publicly available. And we looked at decisions that were rendered between October 2010 and September 2011. So this is before the implementation of the new work reintegration strategy. Now, it's important to mention that few decisions actually reach this level. So we're talking about a small sample that is not entirely representative of the general situation, but it's still a rich source of data, as we're going to be able to see. We searched the decisions for the keyword English, and then we went through the decisions to focus on decisions that had to do with linguistic minorities. And ultimately, we retained 189 decisions, and in 77% of these decisions, return to work was actually the issue, which in itself is an indication that return to work is a significant problem. So the analysis demonstrates that there are two types of difficulties that are experienced really at two different levels. The first type of difficulties relates to interactions. And here we're talking about communication problems, but also power differentials that result in abuse and exploitation on the basis of language, among other things. And we found difficult interactions with employers, healthcare providers, and adjudicators. And the second type of difficulty relates to specific policies and practices that don't take into account English language proficiency. Now, I'll give an example of the first type of difficulty with regards to interactions with employers. And the dynamics, these sorts of difficult dynamics with employers were very evident in decisions that had to do with work accommodations. So, for example, in many cases, the workers didn't understand the details of their accommodations, or sometimes they were assigned to tasks that didn't take into account their language barriers. So, for example, they were assigned to data entry. In some cases, some employers refused to put in place accommodations, or also in other cases, they did, but they created toxic situations that forced workers sometimes to quit their jobs. And I'll give you, so this is from one of the decisions. So this is an example of these types of difficulties. And this is a summary of the worker's testimony. So he returned to modified duties. He continued doing these duties until his employer advised that they could no longer offer him modified duties because other employees with more seniority than him also required modified work. The plant manager harassed him on a daily basis by telling him that he could lose his job for reporting an accident to the board and that it could affect his Canadian immigration status. At other times, the plant manager told co-workers that the worker did not speak English. He told the worker that he lacked education and threatened him with the loss of his job. So these are the types of situations that were actually quite commonly reported in some of these decisions where workers were exposed to threats and harassment by their employers, and that some of this power, these power dynamics really had to do with the status of the worker and, as noted here, the lack of English language proficiency. So in those cases, what happened to the workers? A lot of the workers actually didn't return to work. And often they did so without communicating that information to anybody. So they wouldn't communicate the information to their employer or to the WSIB. And this behavior, unfortunately, was seen as lack of cooperation. And as a result of this, in quite a number of cases, services and benefits were terminated on that basis. Our analysis also identified a number of policies and practices that were particularly problematic for this population. And there are a number of examples that I would like to go through. The first one had to do with assessments and the fact that assessments were often done in English. So these assessments can be done for any type of reasons. For example, to assess the worker's IQ. And sometimes material was available in other languages, but access to these materials was not done systematically. And this resulted in assessments that were incomplete or inaccurate. And nevertheless, they actually formed the basis of decisions. Another problem had to do with the evaluation of the worker's English language proficiency. And what was interesting is that, again, this was not done systematically. And it led to conflicts because often the WSIB or the tribunal would base their assessment on subjective evaluations. So for example, how does the worker react during testimony? Do they look like they understand what the person is saying? So based on such subjective assessments, they would determine whether or not the worker, in their minds, understood English. And the evaluation of English language proficiency is a central aspect of the determination of employability and also of suitable occupation. But yet there was no systematic way to evaluate this. Another issue was that the suitable occupations that were identified for the workers were not always appropriate for workers who didn't master the English language. So for example, some workers were assigned to jobs working at receptionists or cashiers or customer service representatives. So you can imagine how difficult that is for somebody who doesn't speak English. And the workers, and this does not only impact language minorities, but also this has been a criticism of the system, that workers are rarely consulted with regards to the determination of suitable occupations. As a result of this, workers were usually unable to find jobs in those fields, and if they were lucky enough to find a job in those fields, they weren't able to keep the job. Another issue that we identified was the quality of English language training. So the training was actually identified as being of very poor quality. For example, one worker said he only learned to copy sentences, but he didn't learn to actually speak. And it was a vicious circle between learning and health issues. So health problems affected learning because workers found it very difficult to sit in classes, difficulty because of physical pain, also concentration. At the same time, English classes were a significant source of stress and insomnia and health problems for the workers. As a result of that, in a lot of cases, workers missed class or stopped going, and again, this was seen as a lack of effort or a lack of motivation or cooperation on the part of the worker. Same thing with academic and skills training, which required command of the English language. And because of that, in some cases, the WSIB favored on-the-job training. But again, on-the-job training was also difficult because it required the workers to communicate with supervisors, colleagues, customers. And in quite a few cases, the workers weren't able to complete the program, which affected their eligibility to benefits and services. Another issue had to do with job searching expectations. The traditional job searching tools of looking at newspapers, or more commonly now on the internet, was often very difficult for workers who lacked English language proficiency. And often they actually needed the help of others, sometimes their children or other relatives, in helping them look for jobs. So the WSIB sometimes encouraged the workers to look for jobs in their language communities. But the problem with this policy, and there are a number, or this practice, is that there are a number of issues with it. In some cases, workers complain that, well, they actually don't live close to their so-called community. So it's not convenient for them to look for jobs there. Also, these are actually more restricted labor markets, so there are fewer job opportunities in those markets if you're only going to confine yourself to those communities. But also, most importantly, is that a lot of these jobs in language communities also require the English language, because if you can imagine working in a restaurant in Chinatown, you will need to speak English. So in a lot of cases, workers had no choice but to find other manual jobs where they would re-injure themselves, and re-injury was actually quite common, or they would just be unable to work. Finally, one last issue had to do with interpretation and translation services that weren't used systematically. And in a lot of times, the responsibility for translation and interpretation was placed on the worker. And so workers would use relatives, often children, as informal interpreters. And studies have found that this results in quality issues. So as a result of that, there were discrepancies, and the discrepancies led to sometimes denial of benefits and services. So these are just some of the policies and practices that we identify through this analysis that don't take into account workers' social location, the fact that they have English barriers with English. And I just want to read two quotations from these cases, just to illustrate a little bit more some of these barriers. So this exemplifies the issue with training. The worker testified that she found the voice recognition software training difficult because she was unable to recognize words, and she needed additional ESL to allow her to operate the system. She had difficulty writing or using a keyboard because after 5 minutes, her fingers would freeze up. She was only able to work at computer training for 20 to 25 minutes a day. So in this context, it's both the physical limitations and also the language limitations that make it very difficult for this person to be involved in training. And this quotation has to do with employment, this idea that workers should find employment in their language community. Eventually, he restricted his search to employment in his native community, but found that all such jobs required physical labor, with which he had difficulty because of his prior back injury. So these barriers negatively impact return to work. And as a result, what we found is many cases of chronic unemployment, also intermittent employment, and also workers returning returning to work in low-wage, precarious jobs. Some of these workers returned to work in manual jobs where they further exacerbated their health problems. And it's important to keep in mind that a significant proportion of these individuals had been deemed employable, yet they had not successfully reintegrated the labor market. So these are some of the impacts that we found, but there wasn't a lot of information about really what happens to these workers. And this is what I want to highlight in the second study when I talk about the second study. But first, what should be pointed out is that our results demonstrate a couple of things. First, it demonstrates the need to improve the linguistic competence of public organizations, which involves providing for systematic interpretation and translation. But often, linguistic competence is the extent of it. Well, we should develop linguistic competence, and people should learn to communicate in English, and we should provide translation. But that's not enough, because as we saw that there's a need to address not just the ability to communicate and provide tools for that, but also the system issues, the policies and the practices that result in those discrepancies, these disparities. So in terms of policies and practices, for example, what our study highlights is the need for more follow-up and more support in cases of temporary reassignments, for example, or the use of standardized tests for English language evaluation. And it's also important to mention that English language training and good quality English language training is also important, because without it, the workers will only have access to manual jobs where, again, they will face the risk of re-injury. So we are pursuing this line of research. We were recently, I say we have research from the Institute of Work and Health, and also Alan McEachen is on this study. We're pursuing this project. We recently got a SSHRC grant to do a comparative study of linguistic minorities' access to workers' compensation in Quebec and Ontario. And we're going to compare both jurisdictions because they have very different approaches. So in Ontario, there are some language accommodations that are provided. So for example, there are some, even though it's not provided systematically, some translation interpretation services. Also, some documentation is translated in other languages. Quebec has a very different approach to it, where their policy is that all services must be provided in French. So they actually don't provide information or services in other languages. So we're going to see how this plays out and how this impacts the experiences of language minorities in these two jurisdictions. Now, the second study that I want to talk about focuses more on the impacts of unsuccessful return to work, and this was conducted with my colleague Rebecca, who's here today. And studies have found, just a little bit of background, there isn't a whole lot of research on this, but previous research have found that injured workers who don't successfully return to work after a work-related injury experience some impacts, such as financial hardship, family and social disruptions, depression and alienation, and also new occupational injuries and illnesses from working in jobs that are different from those that they held before the injury. Also, what's interesting is that this research shows that the impact is mediated by interaction with employers, healthcare providers, and workers' compensation, so that these various systems shape responses to occupational health problems and matters of return to work. Now, when we set out to conduct this study, one of the first issue was, well, how do we define unsuccessful return to work? And so we define it in this particular study as not returning to the same job or an equivalent job, resulting in unemployment or underemployment. So the objective was to explore the experiences of injured workers who do not successfully return to work. And we conducted so this is a fairly small study, it's a pilot study. We conducted qualitative interviews with 11 injured workers in the Greater Toronto and Hamilton area that haven't successfully returned to work, and we also spoke to 4 service providers. The length of time since the injury occurred was between 15 months and 28 years. At the time of the interviews, 8 workers were unemployed and 3 were working part-time. 3 indicated that they had no income or were getting assistance from other benefit systems, so for example, ODSP. And all of these workers had workers' compensation claims with various outcomes. And only 3 were currently receiving income benefits from the WSIB. Now, one thing that I want to highlight is how policies can impact different groups of workers differently based on their social location. And I want to highlight this through the example of the identification of suitable occupation. So remember in the first study how workers were told that they should go find jobs as cashiers and customer service representatives. Now, another issue that came up in this particular study had to do with workers who had experienced professional de-skilling. And so, for example, in this case, this worker said, so my qualifications, I could do the needle injection. So this is a nurse. So this is a worker who was trained as a nurse, who was working as a personal support worker, and she became injured at work. And she described being retrained to work in a laundromat. And she talked about how the retraining didn't take into account her prior skills and also her interest, which was to stay in the health-related field. So she said, so my qualifications, I could do the needle injection and I want to find a job in the future like related to being a nurse, but WSIB sent me to lesson for laundry. So in that case, the way in which suitable occupations are identified in this particular case actually contributes to this person's professional de-skilling. So the same policy can actually impact different populations differently. In terms of the impacts, we found a number of impacts, negative impacts on workers and their families, such as financial stress because of lost wages, legal fees, medical treatment, a lot of family tensions because of changing roles and responsibilities, and also because of financial hardship. And interestingly, those who had family, relatives in other countries and would send money to their home countries also talked about the disappointment in not meeting those expectations, and in some cases, their inability to be in a position where they can sponsor family to come to Canada because they had experienced this injury and were not able to work. A lot of people also talked about new health concerns, and some of these health concerns, interestingly, was as a result of interactions with the workers' compensation system, which basically reflects data from a study that was done by Catherine Lepel a number of years ago that showed that workers experience psychological distress as a result of their interactions with workers' compensation. And in this case, because of delegitimization and unrealistic expectations, workers experience a lot of anxiety and stress, but also because of negative interactions, mistreatment by employers and colleagues, premature and unsuccessful attempts at returning to work, lack of adequate accommodations. So a lot of psychological and physical health concerns that added to the burden of the occupational injury in the first place. And participants also talked about more general social stigma that made it difficult for them to return to work or to feel good about themselves. So for example, people assuming that if you had a work injury that you should look sick, and that they didn't look sick. So one thing that I want to highlight through this is, and this is really was done through one participant's quotation here, where this person talked about the fact that there was little follow-up or concern for injured workers and what happens to them after their benefits are terminated. So she said, 5 months, I'm without a cent income. Nobody knows if I'm just boiling water and drinking it or putting a sock in it or whatever. You don't go out and tell people this is how you're going to live in your house, and at the same time they expect you to get healthier, to emotionally be better, to physically be better. On what? If you're only eating carb all the time, how can you get healthy? So one of the points here is the importance to consider the long time frame of some of the impacts and the fact that these trajectories were experienced over long periods of time, and often these impacts were cumulative. So we're in a process of developing the analysis around the implications and recommendations. So in conclusion, it's important to think about social location in understanding return to work. So first of all, the same barrier can impact different groups differently. So for example, assessment, methods of assessments can work for somebody who has no language barrier, but if you're not able to read English or write in English, it can make things very difficult. Also, suitable occupation can have different implications based on language or based on prior qualifications. So the same barrier can impact different groups differently. The same impact can also be experienced differently. So for example, financial stress can have a different impact on immigrant workers who are responsible for sending money to their families overseas. So as a result of this, some groups may experience some barriers and some impacts either disproportionately or differentially. And the last point that I want to make in looking at these two studies, what really struck me was the long-term impacts of unsuccessful return to work. So I know that eventually when talking about how do we measure return to work outcomes, that the time frame is extremely important. In both studies, a large proportion of workers had long-term impacts. And recently, a report came out of Quebec that was done by UTAM, Union des Travailleurs et Travailleuses Accidentées de Montréal. And they surveyed 215 individuals who experienced an occupational injury or illness and had benefited from work reintegration services. And what they found is that 10 years after having received work reintegration services, 73% of the workers didn't work, and their salary were 31% less than what it was before the injury. And also that half during that time period had experienced a new injury. So they really highlighted in their report the importance of looking at time frame and at looking at these long-term impacts, even among a population that had benefited from work reintegration services. So thank you very much.